Well, good afternoon, everyone, and I want to thank you for joining us for today's January 11th, 2021 public briefing on behalf of the City of Richmond. Today, we will begin with a public health update. So here are the COVID-19 numbers for our city. According to the Virginia Department of Health, the City of Richmond has seen 34,798 positive cases since the beginning of the pandemic. Our 7-day average of new daily cases is roughly 207 cases. That's similar to what the number was last week. And as is custom, I'd like to ask that we take a moment of silence in remembrance of those we've lost during this pandemic. We've lost 393 community members since the start of this pandemic in March of 2020. Thank you. Now, as cases rise, vaccination and testing continue to be our best tools for preventing the spread and keeping immunocompromised individuals and young children healthy. Now, per recent CDC guidance, if it's been 2 months since the Johnson & Johnson shot, or 5 months since your last Pfizer or Moderna shot, you should get boosted. Let me repeat that. 2 months since the J&J, or 5 months since your last Pfizer or Moderna shots, you should get boosted. They are available right here in the city limits. Youth ages 12 and up now can get their Pfizer booster as well. The health district is taking appointments and walk-ins for youth vaccinations and boosters, so spread the word to families close and afar that this is available. This is an available option to them. And as always, you can learn about your vaccination opportunities at vax, that's vax.rchd.com, or by calling the health hotline at 804-205-3501. Now, if you're vaxxed, please do still wear a mask. Here in the city of Richmond, at City Hall, and all corresponding public buildings, we still have a mask mandate in place for our city employees. And so we believe that wearing a mask in indoor public spaces will add another layer of protection for you, even if you are triply vaxxed, right? The primary series plus the booster as well. So add this layer of protection moving forward. Now, if you're not fully vaccinated, please know that it's never too late to protect yourselves and the ones that you love. If you choose to be vaccinated now, you will not be judged. You will be thanked. And so if you need more information about vaccination, or if you're curious about it, please continue to visit vax.rchd.com or call the hotline and ask any questions. Dr. Avula and his team have been answering questions for over a year now, and they will tell you how safe this vaccine is, that it's free, but most importantly, that it's effective. One stat that I read the other day that is, to me, it's astonishing. If you're unvaccinated, you are 17 times more likely to die if you were to contract COVID-19. 17 times. Now, as I stated earlier, we are not going to judge individuals for whether or not they get the vaccine or not. However, that stat is very important because when the holidays roll around again in 2022, we want you at those dinner tables. Thanksgiving, the Christmas holiday, Hanukkah, you name it. And you put yourself at risk if you go unvaccinated for another year. I know it's going to take some time. We talked about this, Dr. Vull, about how much time it was going to take for folks to come around. And over 60% have at least received one shot in the primary series. That is promising. But I know that Richmond, we can do better than that. And so if you have any questions about the vaccine, If you know a friend who's unvaccinated who needs questions answered, please reach out to the health district. Please call 804-205-3501, and information can be provided that gets you up to date on this vaccine. Now today, I am joined by Dr. Danny Avula of the Richmond Henrico Health District. And he's here to provide an update on our current status as a community. And Dr. Avula, I want to also, before you come up here, thank you for your work at the state level. We received news last week that you were obviously going to return. We knew that already. But it should not go unnoticed that you have lived and breathed our response to the pandemic over the course of, since the beginning of March of 2020. And I want to thank you for doing two jobs, being the face and director of the Richmond Henrico Health District, but also the face of the Commonwealth when it comes to getting those vaccinated as well. You should be very, very proud of your work. Looking at the numbers that Virginia has achieved, we are in that upper quartile, I guess you could say, of states that have high vaccination rates. That's because the work that you put in, and we're grateful for your contributions and your service, but we're glad to have you back focused solely on the city of Richmond as well. Thank you.
Thank you, Mayor. Really appreciate those comments, and I'm certainly proud of the work and even prouder of our team at the Richmond Henrico Health District. I mean, just the way that everybody stepped in and carried this work forward in as much a time of crisis as any has been remarkable. So thank you for being so gracious and sending me on that mission, and glad to be back in the city. Big news for this week is that the hospitalizations nationally and statewide have hit an all-time high. And right now in Virginia, 3,600 people hospitalized at one time. It's the highest number that we've ever seen. And I share this because at this point in the pandemic, we are seeing cases like we've never seen, but it's really the severe disease that is concerning, the degree to which people are hospitalized and are dying of this disease. Because as many of you have probably felt, either you've gotten COVID yourself or you know somebody in your family or close circle of friends who's had it. This Omicron variant is so contagious that we're just seeing it spread like wildfire, and everybody's going to be impacted by it in some way. And so we really need to focus on that severe disease component and the ability of our healthcare infrastructure to help support those who are acutely ill. As I've talked to my colleagues in healthcare systems here in the Richmond region, all of them are struggling. They're in crisis staffing. They're seeing their hospital wards filled up. The emergency rooms are full of people trying to come and get treated or to get tested. And so for those of you who are thinking, what can I do? I think this is the moment for us to recognize that our healthcare infrastructure is really struggling and to continue to take these steps of caution. Get vaccinated if you're not. Right now, there are so many opportunities in the city of Richmond to get vaccinated. We have our daily operation out of the Arthur Ashe Center, and the health department continues to do weekly vaccination sites. Go to vax.rchd.com to figure out where those sites are in any given week. But really, almost every single day, there's an opportunity for you to get vaccinated or boosted. That boosting part, as the mayor said, is extremely important. We're seeing the impact of boosting as very protective against both catching the disease, spreading the disease, and then developing severe consequences. So we want to make sure that people are boosted. Recent update to the CDC guidance, as the mayor said, if you are 5 months out of your Moderna or Pfizer, or 2 months out of your Johnson & Johnson. And that's an update because it was previously 6 months. So 5 months out of your Moderna or Pfizer. And then the other recent update is that adolescents 12 and up are now eligible for boosters as well. Since they only received the Pfizer vaccine, that's 5 months beyond their second dose. So a lot more people who are now eligible for boosters. Let's make sure we get them boosted to keep them protected and to keep folks out of the hospital. We need to continue to wear masks. We want to stay home when we're sick. And then if we are symptomatic, get tested. And I know that's a challenge right now. We've done a lot to try to increase access and capacity to testing over the last couple of weeks. Right now, we've just opened up a community testing center up at the Richmond Raceway. They're doing about 500 to 600 tests per day, and almost every day they're meeting that capacity. We're also offering multiple testing sites around Richmond Henrico each week. Again, you can go to rchd.com and click on the button that says, how can I get tested? This week, we've got Deep Run Rec Center that was just yesterday, full capacity. Southwood had all of their appointments filled on Friday. And then we've got 2 walk-up events, Wednesday at Eastern Henrico Rec Center and Thursday at Southside Plaza. And we're trying to add to that as we are able. Also, we continue to pull down as many at-home test kits as possible and distribute them to partners so that they can get out into communities. As soon as we get them, we're pushing them out into communities. We've also worked with one of our partners, Test Here. They've done a lot with schools. They actually just opened a testing site at the Bon Secours Washington Football Team Training Center this week as well. So we are doing everything we can to increase testing capacity, as I expect over the next few weeks we're going to continue to see a lot of demand for testing. Thanks.
Thank you, Dr. Avula. Really appreciate the update. I'm sure there'll be questions that will follow. Next, we will have an update on economic development here in the great city of Richmond. It's clear that Richmond continues to be a place that others want to be. And it's also up to us to continue to leverage the desirability to create growth for all within our city. And that means we must continue to focus on creating jobs. We must continue to focus on connecting residents to those jobs through multimodal transportation, and we must continue to increase more affordable housing here in the city of Richmond as well. It means designing and implementing a careful and competitive process to get Richmonders the development they deserve. You all know we have now are pursuing development on off of Arthur Ashe Boulevard in the Diamond District development. There is more to come, and to bring an update on our economic development work, today I have with me Leonard Sledge, Director of Economic Development for the City of Richmond, and Maritza Peachin, who is the manager of our Office of Equitable Development here at the city. Leonard, and then Maritza.
Thank you, Mayor Stoney. Good afternoon. I'd just like to share a brief update in terms of some of the economic development activity in the city, and then turn it over to Maritza. In fiscal year 22, the fiscal year that we are in now, that will end on June 30th, year to date in the city of Richmond in terms of economic development projects that we have worked on, they have resulted in more than $510 million in announced capital investment and more than 2,100 new jobs announced. The most notable, last month, the public may recall, the CoStar Group announced an expansion of their facility here in the city of Richmond, which represents approximately $460 million of new investment, will result in over 750,000 square feet of new LEED certified Class A construction in our downtown footprint, and will add nearly 2,000 new jobs to the city. Also at the Deepwater Industrial Park, which is being developed by Horgan Construction, Lowe's Distribution will be occupying, Lowe's will be occupying a 1.2 million square foot fulfillment and distribution facility here in the city of Richmond. And also, we anticipate some additional good news to be able to share today as well. And combined, fiscal year 21 and 22, the economic development projects that we've worked in the city of Richmond have resulted in more than $920 million in announced capital investment and over 3,100 new jobs announced. And while, yes, a lot of that activity has been the result of larger companies growing and expanding in the city of Richmond, we are also mindful of programs that assist in the development and growth of small businesses in the city as well. And so with that in mind, we would like to let our business community and our development community know that there's still funding available through our local enterprise zone grant program and also our commercial area revitalization effort grant program. And for more information about those, please feel free to contact the Department of Economic Development at 804-646-5633. And with that, I'd like to turn it over to Maritza.
afternoon. I'm really excited to talk to you about the Diamond District project. And we've been working on this for over 10 years as a city. We've demolished buildings. We have abated the site. And then we adopted the small area plan in 2020, and we rezoned the property in 2021. So this has been a process that has been going on for a long time in the city of Richmond. The small area plan called for transforming the property. In October, we unveiled the Diamond District branding and website, which was a signal to the development community and Richmonders that the redevelopment process was continuing. And we were implementing that small area plan and the vision outlined there. The request for interest is the next step in transforming that property. As the mayor said, it is a careful and competitive process. The RFI was released on December 28th, and submissions are due February 15th. People can find out more at rvadiamond.com. An RFI is an opportunity for city leaders to learn more about the development teams interested in this project and what they have to offer to our community. An evaluation panel comprised of city staff, council members, and VCU will review the submissions. The evaluation panel will shortlist them, and respondents and those shortlisted individual groups will be invited to respond to a request for offers. That will ask for more detailed information. So it goes first RFI, where we ask people for their vision and their qualifications to implement that vision. And then we shortlist down to the RFO, where we ask them for offers and more details. So the process starts winnowing down. That RFI document, available at rvadiamond.com, outlines the city's goals and evaluation criteria for how we're going to winnow down. The goals were drawn from small area planning processes and other recent economic development projects, like the public safety building development agreement. So that's where we got that content from the small area plan and from other deals that Director Leonard Sledge has negotiated on behalf of the city. So that's one of the really exciting things. The other really exciting thing is the city center plan. City center is the area that we call where the Coliseum is, and that area is right around here, around City Hall. It has a lot of parking lots and abandoned buildings. That plan was adopted by Planning Commission in December, and it will come to Land Use Committee next week, and then to Council for adoption on the 24th of this month. So that plan calls for having City Center become the engine for expanding Greater Richmond's life sciences industries and for becoming this life sciences innovation district. So we're really excited about that process. Once that plan is adopted, we'll move into implementation, just like we're doing with the Diamond District. And that first phase will center around redeveloping the Coliseum site itself. Thank you.
Thank you so much, Leonard. Thank you so much, Maritza, for that update on economic development. Particularly, thank you for the update on the plan moving forward with the Diamond District. For those out there who are interested, please, if folks are interested with it, where do they need to go?
rvadiamond.com.
rvadiamond.com. If you are interested in investing in Richmond, right? In the Diamond District, please go there. Now with that, we'll open it up some questions. Dr. Avula.
Yeah, the question is, what are the demographics of who is being hospitalized across the state? And really, what we're seeing across the state mimics what we're seeing across the country, which is that the unvaccinated are disproportionately affected. And we're still churning state numbers. We had some regional numbers from Ballard Southwest Health System that showed that 91% of their hospitalized patients were unvaccinated, and 97% of those who were on ventilators with COVID were unvaccinated. And so still waiting to see what that number looks like statewide, but that mirrors pretty much what we're seeing nationally, which is that over 90% of people who are hospitalized are unvaccinated. And so, again, when we think about what are the things that we can do to preserve healthcare infrastructure and to keep people out of the hospital, getting vaccinated is absolutely at the top of that list.
I was also going to keep Dr. Rula up there for another question.
I understand.
So as we see these hospitalizations, I know staffing is a huge issue. A lot of people coming to work COVID positive, yet asymptomatic, some even with symptoms, I'm hearing. Is this acceptable to you as a health professional? What are the solutions we're looking for?
Yeah, the question is the health system is really seeing such high demand that there are people who are coming to work, sometimes COVID positive, sometimes asymptomatic COVID positive, and those parameters are outlined in the CDC crisis standards. If you go to any hospital in this community, they're all struggling with staffing, and they're doing their best to keep staff who have been exposed out for a few days, who have been quarantined, or if they actually test positive, out for isolation. But sometimes that makes it incredibly difficult to actually manage patients on the floor. And so what some hospitals have done is that they've said, if you're COVID positive, you can come in if you're working on a COVID wing because you're not increasing the risk of the patients that you're coming into contact with. The other thing we know is that the proper use of personal protective equipment really significantly reduces transmission and the ability to contract COVID. And so I'll give you my personal experience. I worked a bunch of nights at the hospital last week, and every waking moment on the floor, I was in full N95. Anytime I'd go in with the patient, I was wearing a gown and gloves and mask. And so, the hospitals obviously know how to do PPE better than anybody, and even if somebody has been exposed, if they appropriately are protected, that can really limit the risk. And so the CDC outlines those crisis standards. All of our hospitals are following those very carefully.
Follow-up question for you. I know a lot of people are saying, Omicron's so mild, these COVID cases are mild, maybe we need to change the way we measure COVID cases, hospitalization. From what you're seeing on the floor firsthand, what would you say to that? What do you think about that?
Yeah, I do think that let me repeat the question. The question is, a lot of people are saying that Omicron's mild, and so is there a different metric we need to use, or how much do we need to worry about the record case rates that we're seeing? And I agree with that to some degree, right? We're seeing an extraordinary amount of cases. This past week, we hit 26,000 cases in the state in a single day. Our previous high from the January wave of January 21 was 9,900. So just to give a sense of relative comparison, we're seeing way more cases than we ever have. But if people were not getting hospitalized, or if our hospital capacity was not really being strained, I wouldn't be as concerned, because by and large, these are causing mostly mild infections, and we have a huge portion of our population who's vaccinated. And so, yes, you can still get COVID if you're vaccinated and boosted, but what we're seeing is if you are protected, you are seeing a mild course of disease. So I no longer think that cases are the primary metric that we need to be concerned about. I think that looking at severe disease, hospitalization, and death, and then right now what we're looking at is hospital capacity. And that's why we're really asking people to take this seriously, because our hospitals are dangerously close to being overrun.
Nicole, did you have another question? Will?
For Stoney. With last week's snow event still on most people's minds, and we possibly might get snow again on Sunday, is the city prepared for any power outages and roadways to be cleared?
The question is, with there was a snow event last week, or at least it was the potential for a snow event last week. We did have a snow event earlier, I believe, earlier last week, or I guess, a week and a half ago. Are we prepared for a potential for another snow event coming this weekend, late this weekend? The answer to that is yes. We are prepared. The Department of Public Works, they put together a winter plan in expectation of winter inclement weather like the one we already had, but also those that could come in the future winter months. Obviously, this is part of our responsibility as a government, but also there's responsibility on the community end as well. If we were to have significant snow, we request that if you don't need to be on the roads, don't be on the roads, right? We have to use common sense in such a critical moment, and it's our hope that snow does not appear, and we can keep school open and we can keep our government open as well. But if not, we ask that you continue to watch news stations like yours, Channel 8, for more updates about where weather, the possibility of weather, and we'll continue to let folks know about what the status of city government will be as it approaches.
Yeah, I saw you kind of nodding as Dr. Avula was talking about what he was seeing in the hospital firsthand. Is there anything that you want to add personally that maybe you haven't touched on that people should know about?
Anything I want to add to what Dr. Avula stated on, just the case counts? Well, first, I think we all can agree that we didn't think that we would be here again in 2022, right? We saw the surge in the middle of 2021. We saw 2020 where there's no vaccine, no therapy really available to us. Now to be here in 2022, to me, I'll have to say, this could have been prevented. And I know I sound like a broken record on this, but the way we prevent this sort of pressure on our healthcare infrastructure is for us to get vaccinated. I know it sounds like I sound like a broken record. I know it's not sexy any longer to talk about vaccines, but I'm telling you the truth. It's saving lives, and also it will relieve our healthcare professionals who've been at this since the beginning since March of 2020. So to be under this sort of pressure again, I mean, the stories that we're hearing from healthcare professionals each and every day, some who are still in it after being in it 24/7 without a vaccine, without a therapy. And the fact that we have that available to us today, and some of us aren't utilizing it, I mean, it's astonishing. You just shake your head about the whole thing. But I'm optimistic that once we come down from this surge, it's my hope that we can return to a time where, our healthcare workers can get the proper rest, so others can actually enter the doors there and receive other procedures as well. I think folks forget that it's just our hospitals deal with more than just COVID-19. They deal with folks who walk in there from, who are having surgeries and other procedures. And if the system gets overrun with COVID-19 cases, we can't see those who might be in critical condition due to other circumstances. So we all have to remember that we're all in this one together. It can't just be all about us. It has to be about the community at large as well. That's probably more than you asked for.
Thanks very much.
Thank you, everyone.
Appreciate it.